Hey everyone, this is Dr. Vivian Asamoah live from Katy, Texas. Oh, something just showed up. Okay. Hi everyone, this is Dr. Vivian Asamoah live from Katy, Texas. Apparently, I have too many things open on my browser. Donna and I were brainstorming about some difficult patients. So we were doing all this research on PubMed and trying to solve a puzzle. So, I'm a gastroenterologist and functional medicine provider in Katy, Texas, and I hope this live is working. Yes. And if you're watching this, it's because you're part of the family on natural gut relief, and we are talking about vitamin B12 deficiency. This is a very interesting topic, and I welcome questions and comments because I learned a lot doing this talk. And so I'm going to see if there are any questions coming in or if anyone is in here. And if you are in here, put in a whoop whoop into the comments or put in something so I can see, put in a question so that I can see that you guys are in here. Oh, there's a comment. There's a comment. Wait, no, there's no comment. Wait, there's a comment. No, not yet. I can't see the comment. But guys, let's talk about B12. So we did a poll, and I was so surprised that you all picked the B12 because I was excited to talk about chocolate and coffee and what's the real deal. And then I found an amazing functional dermatologist who we will be interviewing soon to talk about the gut and skin manifestations, right? So how skin manifestations, skin gut issues can show up as skin issues. And so, said something about setting a time frame, but I hope everyone can hear me. And so, you all picked vitamin B12. And I thought this was an interesting one because I wanted to start off by just sharing some very practical tips. So B12 deficiency is extremely common, and B12 is a very very essential micronutrient, and I will tell you why. But when we think of B12 deficiency, we often think of people with who are vegans, right? People who don't eat red meat and who therefore are not able, because a lot of your B12 you get from mainly from three sources. You get from animal fat, animal food, animal meat. You get from fortified foods like cereal, and you get from the last one being supplements. And so if you are vegan and don't eat animals, you're most likely not going to have enough B12. So apparently 60% of vegans are B12 deficient. So if you're vegan, I'm going to move because I think my internet is not very strong here. 60% of vegans are B12 deficient. I'm walking you guys through our lovely office. You will see. You will see our lovely office. Very nice. Yes. Yes, our lovely office, but I'm going the other way actually. Yes, yes, yes. So 60% of vegans are B12 deficient. So if you choose to go vegan, you got to have B12. You got to be on B12 supplementation, okay? And then I posted who else could be B12 deficient in one of the posts we did this week. And so one thing I learned that I did not know is that older people, as you get older, you start your acid in your stomach starts lowering, and this is important because B12 needs to be is only absorbed in an acidic environment. There is a factor called intrinsic factor that exists in the stomach and the gut. And for intrinsic factor to work, it needs an acidic environment to cleave, which is to break B12 from food and use B12. So if you've got low stomach acid, because apparently after the age of 60, I'm not going to say 50, 50 is too close, but after the age of 60, our B12, our stomach acid starts going down. I didn't know this. And then, of course, people who are on acid blocker medication, right? Those, the Nexiums, the pantoprazoles that we've been talking about for quite some time, B12 will also go down there. So those are some situations. We talked about vegans, we talked about low stomach acid. Those are some situations where the B12 will go low, won't be enough. Medications like metformin will compete with B12. B12 will go low, and situations where you're taking metformin, which is a common medication for diabetes. And so a lot of people probably don't know this and should be taking B12 supplementation. Other situations, anytime there's malabsorption, celiac disease, Crohn's disease, B12 issues. And important to remember, guys, that B12, you have to have a good stomach, so enough acid to get the B12 from food. But in terms of absorption of the B12, that end portion of the small intestine called the terminal ileum, like right before you get into the colon, that's where a lot of the B12 is actually absorbed. So if you've got Crohn's disease in that area, or inflammation in that area, or parasites, or what we've been discussing, SIBO, small intestinal bacterial overgrowth in that area, B12 will not be absorbed and B12 will be low. And then we talked about, finally, this group of people who have an autoimmune gastritis, where they make antibodies against that intrinsic factor that is responsible for cleaving B12. If you've got that autoimmune gastritis, you will have issues with B12 as well, right? So those are some of the common causes of B12 deficiency. Let me just make sure I haven't forgotten anything else, and make sure this is also working on my other screen. And we'll start now talking about the symptoms, and I'll explain why there are so many symptoms associated with B12 deficiency. This was kind of amazing. Okay, looks like I'm on. Nicole says we can hear, but I can't see the questions, which is a shame, so I'll look here. So, symptoms associated with B12 deficiency. So many. And why? Because B12 is such a critical nutrient in our body for many reasons. B12 is actually converted into, it will transform into something called methylmalonic acid. And this methylmalonic acid will convert into succinyl acid. And this succinyl acid is what goes through that Krebs cycle, basically called the citric acid cycle, to make energy. So if you've got issues with B12, you're tired. That's job number one. One of the many jobs, but job number one. Job number two is even more important. B12, okay, will lead to homocysteine, which will make methionine, which will then make SAMe, and SAMe is an important methylator in pretty much every single process that exists in the body. So B12, I'm starting to think B12 may be more important than vitamin D. I really think it is. So a deficiency there will cause symptoms such as, you're not methylating, you're not making neurotransmitters. So depression is a common one. And this is why it's always important when someone is depressed, we don't often think about it, but think about a micronutrient deficiency that could have probably led to this depression. Depression is a big one. When I was doing the research on this, I was reading multiple articles talking about, okay, what are the signs of B12 deficiencies? And in one of our biggest journals, the New England Journal of Medicine, published just last year and then again the year before, there was a huge article about a 62-year-old guy who everyone thought had early dementia. Everyone thought he had early dementia, and he was depressed. They were going to pretty much take him to a nursing home, until one doctor, this was in the UK, just did a lab check on B12, and his B12 was non-existent. So they figured out why, repleted his B12, and he was back to himself. So before anyone takes you to the nut house or the cuckoo house, or before anyone prescribes you with any crazy antidepressant medication, right, you may have some depression, but if you have a B12 deficiency on top of that, maybe that's what throws you into a deeper depression. Check your micronutrients, especially the B12. So anxiety, depression check your B12. And we'll talk about where your numbers need to be and which numbers are significant and testing. This is the part that I found really interesting. So depression, anxiety, fatigue, brain fog, right? B12 is really also important in the myelin sheath, anything that's nerve related. So pins and needles, we call that paresthesia, right? What else do I have? Glossitis, if you see someone with a red, beefy tongue, it is called glossitis from a deficiency in B12. You may be anemic because B12 is also involved in making red blood cells. I mean, it's literally involved in everything. I want to make sure I don't forget anything because, yeah, everything, weakness, everything. So it's an extremely important vitamin, extremely important. Now, let's talk about, everyone was like, oh, I need to get tested. You need to get tested. But I will say this, Nerdy Asamoah forgot about this. And in some of my patients now, I want to call everybody back and be like, I need to check your levels again. I need to check all your levels, because if you just check vitamin B12 with like Quest Lab or like, whatever, LabCorp, these your traditional labs, and your doctor only checks B12, it may be falsely normal. Big point of today's talk. It is not enough just to check B12 in blood. It may be falsely normal. It may not represent B12 in tissue. And it is B12 in tissue that we need to see. Another important fact is that B12 is stored in the liver for years. So by the time we actually see a depletion or a deficiency, you've had a deficiency in B12 for a long time. By the time it correlates to blood, that means you've had it for a long time, which means your Krebs cycle wasn't working. So you've probably been tired for many, many years or months, which also means that SAMe, that is important methylator for every single other process to happen in the body, hasn't been taking place. Depression, anxiety, brain fog, lots of other issues that could be affected. And even just, managing the DNA and making sure your DNA is clean. So when you go see your doctor, now that you've watched this Back to Basics Live, Natural Gut Relief, you'd be like, yeah, can you check my B12? And you say, and can you also check, doc, my methylmalonic acid? The two of them must always be checked, because if your B12 is falsely normal, right? We know that the serum representation, the representation in the blood is not exactly what is actually going on in tissue. So you could still be deficient, but your methylmalonic acid, what I termed as MMA, is high, then you're deficient. So always check both, right? Now, which numbers are okay, right? So we won't talk so much about the MMA. Once that's high, you're B12 deficient. We got to look further into that. I would actually do like a more specialized testing. But anything under, they say 200 or less is abnormal. From a functional medicine standpoint, we actually think that is, 300 to 500 is probably abnormal. We think that 600, greater than 600 is where you need to be. That's the number we should strive for. So generally, in a lot of our patients in the 250, 300, we call them deficient, right? And there's some patients, of course, who are like 90, 0, like it's really, really low. But your goal is to be greater than 600. It's such an important vitamin that I would say if you're not at 600, take a supplement. Take supplementation for it, okay? So that's the number that you want to be at. And always remember, ask your doctor, hey, doc, did you check the MMA? And your doctor will be like, what are you talking about? What? No. Nerdy Asamoah. I have looked this up 100 times and checked on New England. I've looked at all the sources, reliable sources. Vitamin B12 should always be checked with MMA. I'm a loser, doc. I know I did not check it on all my patients. Y'all may be calling me tomorrow, be like, did you check my MMA? I didn't. But the possibility that just checking B12 in blood being falsely normal is so high that you have to check the MMA. It doesn't make sense. You have to check it, right? Okay, I discovered that. Okay, what else did I discover? Something that was actually kind of depressing. We mentioned the three sources of B12, right? Where do we get the B12 from? We don't have it in our bodies. We must get it from the outside. There's some bacteria in our colon that make B12, but it's not enough to support our entire being. We get it from animal food. The best sources, actually, you get it from meat, you get it from eggs, but the cleanest sources that you can actually absorb enough of is from fish, from seafood. So look at seafood as a source for B12. But in America, believe it or not, the most common source of B12, like where we get it from, fortified cereal. We're not getting it from wholesome foods and vegetables, guys, wholesome foods and, seafood or animals. No, Americans are getting their B12 from cereal, fortified cereal in the morning. The problem with the fortified cereal, let's not even go into the whole dynamic of cereal. You guys know how I feel about cereals in general. I'm like, nobody, the cereal is made in a factory. Have you ever seen a planted Cheerios or a planted Fruit Loops coming out? It's all processed, right? No matter whether it says wholesome, whole grain, 50 grams of carbs, whatever, it's processed. But the B12 in the fortified cereal is readily absorbable. So even if you don't have enough hydrochloric acid in your stomach, you will still absorb that form of B12. Okay, but sometimes it's too much. They give us way too much than the body can even tolerate, right? And you're not going to do anything with that. The third source of B12 was from supplements. So making sure you're taking high quality supplements. When it comes to supplementation, there are three forms, guys. There is the pills, the pills, supplement pills. Then there are shots, doing IM, intramuscular shots of B12, and then also sprays, nasal sprays of B12. Sprays are actually very well absorbed. Like they diffuse it straight into the bloodstream, and you get to good numbers. Shots are also very helpful when somebody has low stomach acid or has that pernicious anemia. Because if you have pernicious anemia, we would rather you take the shots because we don't think you have the acid to be able to get the B12 from from the pill or the supplement. So ideally you want to take the shots if you have that autoimmune gastritis of the stomach, right? You want to do the shots. And shots are helpful, pills are helpful, and the spray is helpful. So just depending on what your underlying cause of the B12 is, you then take your treatment. Your doctor or whoever your provider should guide you as to what the right form of treatment is, right, for you. That's one thing I learned because I remember a patient with pernicious anemia and she didn't want to do the shots. And I was like, yeah, you can take pills. But now I remember she's older. She's got autoimmune factor. She's not going to be able to absorb the pills. I should have pushed to keep her on the shots. So that's really important, guys. That's important. What else about B12 did I discover? I mean, quite a lot. It's such an important vitamin that everybody should be taking B12. Let's talk about the formulations. I did do a post saying there are 4 types of B12, the cyanocobalamin, the methylcobalamin, and the hydroxy and the adeno. There are 4 forms. The one that's actually the most active and the most readily used is the methylcobalamin. So that's the one that you should be on. That's the one that's most easily used. But I think in just traditional pharma, we see a lot of the cyanocobalamin. But the methylcobalamin is the best form. So when you start taking B12, and in order to start seeing reversal of symptoms, it can take anywhere from a couple weeks to a couple months, depending on what the symptoms are. For the neurological symptoms and psychoneurological symptoms like anxiety and depression, couple months. But for anything that's related to energy, and that's why we use it for weight loss, right? Because it's involved in that Krebs cycle and making energy, you will see results a couple weeks. It's pretty fast, right? And I had just thought about something with B12 and that I forgot. But if I remember, I will let you guys know. So yeah, it takes a couple months to be on it. If you are on a PPI or chronically on metformin, you should just be taking B12 every day, like at least 1,000 units a day. Right, 1,000 units a day. And I will post something with exact doses of how much you should be taking if you are deficient in B12. And I would say this is probably one of those that Unless you find the root cause of why you're B12 deficient, you'll be taking it forever. So, again, the take home message from this Back to Basics Live, episode 33, is make sure you're checking your B12. Make sure your doctor is checking your MMA, your methylmalonic acid with B12. Make sure your doctor is trying to identify why you have a B12 deficiency. Are they looking at your meds? Are they asking you about stomach acid? Are they, are you on a PPI? Can we reverse anything? Are they looking at your diet? Are you vegan? Right? Let's actually figure out the root cause and then replete accordingly. And yes, B12 may be the cause of some of your symptoms. And so it's important to check that. That is, I think it should be checked at least once or twice a year. All right, guys. Let me see if you guys have any questions. I don't see any questions. Wait. I see comments. Let's see. So do people, this is Julian, after the age of 60, do they take Beta HCl and Pepsin every day with their meal? I don't think that would hurt. I really don't think that would hurt. Unless you're someone who's known to have high stomach acid, this finding of low stomach acid as you get older is well established. It's well known. So this is what happens in the body. So yes, I would. I think when I hit 60, I'm going to take HCl and digestive enzymes for sure. And then any other question? Oh, Nicole had a question. An issue she's seen when she's working with nursing home and rehab is they have a hard time getting Medicare to cover the micronutrient test. And isn't this a shame, Nicole? Because that older person who's walking and wobbling, because often with B12 deficiency, we'll see some gait, which is walk abnormalities. That person who's shuffling, it may not be Parkinson's. It may just be they don't have B12. And this can be reversed. And then you get them out of the nursing home. And then you save thousands and thousands of dollars. And they're back into society. And they're, yeah, unfortunately, let's not go into Medicare and insurance on that and why we do the things we do. But yes, I definitely agree with you. So if there are no other questions, I will be getting my B12 checked this week or maybe next week. I like to do a specialized micronutrient test that we offer at our office. It also does organic acids. The reason I love this test is really looking at what's happening intracellularly and in the tissue. It also checks for like B1, B2, B3, like all the Bs, B6, B9. And next time we'll talk about B9 because they work together. B12 and B9 are like cousins. They work together to make things work in the body. So I will check all of that. It also checks for like vitamin A, vitamin C, vitamin E. So it tells me about my antioxidant level. It tells me about my manganese, my magnesium, my copper, heavy metals. So this is going to be my before the end of the year test to make sure that I am like everything is all set and I am ready for, my 2022 is going to be like, woof. I am just going to be flying high above. I want to be healthy, fit, and happy. So you guys, I wish you all a wonderful evening. I hope this was helpful. Go get your B12 checked. Share your numbers with us and start repleting, start supplementing if it isn't high, if it isn't where it needs to be, and eat healthy foods, wholesome, rich foods, lots of fish will get those numbers up. Have a wonderful evening, guys. Bye-bye.